Vienna General Hospital, 1846. In the maternity ward, a young Hungarian doctor walking the halls hears a sound that will haunt him for the rest of his life. It is the weeping of pregnant women, begging on their knees not to be admitted to his clinic. They have good reason to be terrified. In the hospital's first maternity clinic, up to 30% of the mothers die shortly after giving birth. They are taken by a swift, agonizing illness known as puerperal fever or childbed fever. Yet, in the second maternity clinic just across the hallway, the death rate is less than 2%. The discrepancy is so famous that women choose to give birth in the freezing streets rather than enter the doctor's clinic. Why is the clinic run by elite medical doctors 15 times more lethal than the clinic run by simple midwives? This was the obsession of Ignaz Semmelweis. Born in Buda, Hungary, in 1818, Semmelweis was a man of observation and statistics. He began a systematic investigation, comparing every variable between the two maternity clinics. He checked the temperature, the ventilation, the diet, and the positions in which the women gave birth. He even investigated whether the sound of the priest ringing a bell as he walked through the ward was scaring the mothers to death. Nothing made sense. The clinics were identical in every physical way, but there was one crucial difference in the daily routines of the staff. The turning point arrived in March of 1847 with a sudden tragedy. Semmelweis's close friend and colleague, Jakob Kolletschka, died of severe sepsis. Kolletschka had been accidentally pricked in the finger by a student's scalpel during an autopsy. Semmelweis reviewed his friend's autopsy report and noticed something shocking. The pathology, the inflamed organs, the purulent fluids in the chest and abdomen, was identical to the mothers who died of childbed fever. In that moment, a horrifying truth crystallized in his mind. The medical students and doctors began their mornings in the autopsy room, dissecting dead bodies. Without washing their hands, they walked straight into the first clinic to examine laboring mothers. They were carrying invisible, lethal cadaverous particles directly into the open wounds of the women. The midwives of the second clinic, however, did not perform autopsies. The gentlemen doctors were the ones bringing death to the maternity ward. Semmelweis acted immediately. He ordered all students and doctors to scrub their hands in a chlorinated lime solution before entering the ward. He chose chlorine because it was the only chemical strong enough to remove the putrid smell of the morgue. The results were immediate and undeniable. Within months, the mortality rate in the first clinic plunged from 18% to just over 1%. By the following year, the rate dropped to absolute zero for several consecutive months. Semmelweis had discovered the secret to saving millions of lives. But instead of receiving a Nobel Prize, he faced a wall of absolute hostility. The medical establishment rejected his theory. To accept Semmelweis's findings meant admitting a terrible truth. It meant admitting that the medical profession had spent decades unwittingly killing their own patients. Furthermore, the doctors took personal offense at the suggestion that their hands were unclean. The elite believed that a doctor was a gentleman, and a gentleman's hands were biologically clean. His supervisor, Dr. Johann Klein, refused to renew Semmelweis's contract, forcing him out of the hospital. Semmelweis returned to Budapest, isolated and bitter. He watched from afar as hospitals across Europe continued to ignore his hand-washing rule, letting thousands of mothers die. His frustration turned into obsession, and his mental state began to fracture. He began writing public open letters to prominent medical professors, calling them ignorant murderers. "Your clinics," he wrote, "are houses of slaughter." By 1865, his behavior became erratic, possibly due to early-onset dementia or severe breakdown. His wife and colleagues decided he had become a liability to the medical community. On July 31, 1865, they lured him to Vienna under the pretense of visiting a new medical sanitarium. It was a trap. When they arrived, Semmelweis was handed over to the staff of a locked asylum. Realizing the betrayal, Semmelweis fought back, screaming and trying to break through the doors. The asylum guards threw him to the floor, beat him severely, and locked him in a dark cell. 2 weeks later, Ignaz Semmelweis died at the age of 47. In a twist of cruel, poetic irony, his autopsy revealed he died of sepsis. An infection had entered a wound on his right hand, likely sustained during the beating by the guards. He died of the very disease he had spent his entire life trying to conquer. Only a few people attended his funeral, and his death was barely mentioned in medical journals. But history would eventually vindicate the tragic doctor. Years later, Louis Pasteur and Joseph Lister proved the germ theory of disease, confirming Semmelweis's observations. Today, we honor him as the pioneer of antiseptic procedures, the father of clean hands. In the archives of the Vienna General Hospital, the old maternity logbooks still preserve the dramatic dip in deaths from May 1847. His academic book, The Etiology of Childbed Fever, is now recognized as a masterpiece of clinical statistics. The asylum intake records from 1865 document the violent struggle of his final hours. He proved that saving lives sometimes requires challenging the vanity of the powerful. His hand-washing basin stands as a monument to scientific truth over professional pride. His tragedy remains a warning about how easily dogma can blind the mind. The complete source notes, citations, and medical references for this episode are archived in our reading room. Link in the description. Subscribe to Legacy in Strokes and help us uncover the unseen footprints of history's greatest lives. Let us know in the comments. Which forgotten pioneer should we cover next? Are you managing your time, or are you fighting your evolution? Every life leaves a trace, even those history tried to sweep away. Read the full article and references on our official website. Help us keep history accurate and free from commercial bias. Until the next episode, this is Legacy in Strokes.